Ghana has now recorded 9 cases of COVID-19. This has been confirmed also in a Twitter message by the Information Minister, Kojo Oppong-Nkrumah.
When coronavirus came, the whole Ghana were all scared. It came to a point you don't know the person that you are attending to, the condition of the patient, you don't know.
Especially those with high fevers, when you attend to them, then they also panic. Like they will say, hey, Madam Patrol,
for that matter, people weren't confident about visiting the hospitals anymore. By the nature of our work, we come into very close contact with patients. So even before the COVID came, we almost always use PPEs. But with the onset of COVID, it meant that we had to even adhere to more stricter measures. Aside that, it placed a strain on the facility in that now it wasn't just the dental facility that was using the PPEs, but then other staff workers had to use the face masks on ordinary days. People who regularly were not wearing face masks were now wearing them. People were not wearing other PPEs, had to put them on, had to protect themselves. So it placed a strain on the facility, and then we needed a lot of materials to come in as in PPEs to support us.
Looking at our facility, there's a health center. I would say that government was more or less looking at the very big facilities, and all the donors were also going there because that was where most of the cases were referred to. It was also very difficult for the nurses because when the information came at first, you know, we were not certain as to what the disease, the mode of transmission really was. So most of the nurses were adamant seeing some patients without these PPEs.
At a time where the country was battling with PPEs, from visors to face masks, we noticed that this agency was working tirelessly using a 3D technology to print some of these face visors. It was such an innovative way of helping government, and we thought it was worthy supporting them, so we had to donate to them.
We were trying to find our own ways of getting locally available materials to be able to get something that was workable, that can help frontline health workers, as well as it's being readily available, because at that time there was a lockdown, there was no movement of goods and services all around the country, so you work with what you have in your country. So we were on high alert to just get what we have locally. We had a team, we sat together, we planned, and we looked at the things that we had available, and we had them. But what we had, the challenge we had was with finances. We didn't have the finances to do mass production or to produce in large numbers. So we launched a campaign for support from various other institutions, and FNB was one of our foremost help with a major finance into producing this face shield. And the project they had concentrated was with the face shield. This face shield will be produced for Ghana Armed Forces to be used by frontline health workers in their health facilities.
Before, there were some items that we were not having, yes. So when the donation came in, it came to support the facility and the staff as well. Yeah, we were not having hand sanitizer dispensers. Yeah, so when the donation came, it came along with those kind of items. Yeah, so management put it at vantage point, and it helped all the staff.
Though we applied to certain organizations, none responded. But out of the blue you came. It was great news to us.
It came in at the right time. It was really helpful, and it met our needs. Without it, you can trust me, the dental facility wouldn't be able to run as efficiently as it did, because without PPEs, there's no way we can see patients, not even on a regular day. So with COVID coming in, that meant that we even had to do more. So it really helped us, and we are much appreciative to First National Bank for the gesture. We thank you so much for that.
I saw Captain Tom Moore in Britain. He was working to raise funds for the veterans and the frontline workers. Then I said, oh, why? Captain Tom Moore went to Burma, like myself. Then he's 100 years, he's still alive, 100 years. And I'm 95. I also went to Burma. And he is a veteran. I'm also a veteran. I can do this thing also for my country, Ghana, and Africa as a whole. Then a friend that I have been talking to, he asked me, do you think you can do it at your age? I said, I'm certainly going to do it. My spirit was very high. I said, I'll do it. If he has been able to do it, he served in Burma, he fought. I also fought there. He's a veteran, I also a veteran. Then we set a date, 19th of May, last year. I will walk. I worked with doctors, musicians, the chief executive of the First National Bank. Also, they came. I worked with him and a few of his people. Your bank is a wonderful bank. They are doing marvelously well. From my own mouth, I will tell you, it's a special bank. I know why I work to help the veterans. Why? Because we went and fought and we passed through troubles, sorrows, and everything. So anything that happens to me, it happens to them too. I know they are old. Because of this now, I have my own foundation, Joseph Achitenhamo Foundation, to enable me to help my colleagues very much, fully, maximum, all the veterans, war veterans. First National Bank, excellence. They have been doing marvelously well. And the bank will grow from strength to strength. It will flourish. And their success, the limit is the skies. They will definitely go on.
So for us as an institution that thrives on a great principle of helping the society grow and helping the society advance, we see some of these donations that we are doing and Aspire as part of what the brand stands and what the brand lives for. Beyond the feedback we have received from our customers, the Ghanaian people, and even our staff, we think that we need to do more against the fight of COVID-19. It is raging quite quickly, and we expect that in the months to come, we should be able to especially put some more investment in the healthcare sector to support all these institutions helping us to fight the battle against COVID-19. We encourage our staff to continue contributing to the Aspire Fund, and we hope that in the months to come, we'll be able to grow the Aspire office in a way that we can help a lot more institutions. We thank our staff, and as we've always said in the bank, we must help ourselves and make sure that we fight this pandemic and make sure we eradicate it totally from our society.